basically I went home from work on a Monday night with the worst headache ever. Got home, thought, okay, I'm just gonna go to bed, lay down, and got up in the middle of the night, puking my guts out, just could not stop. Just my whole body was just going through reaction, and I had puked so much that finally I started having seizures in my neck and my back, and just uncontrollably. And I remember grabbing the telephone, the cordless, walking around thinking, should I call 911 or not? It's like, I don't know, And then I started getting the seizures, and it's like, oh, this is something different. Maybe it's more than just a headache, but I still can't bring myself to dial 911. And so the last thing I remember is going down to the kitchen, trying to get a glass of water, and laying down on the kitchen floor with the phone in my hand. And I don't remember any of those 2 days or anything. Last thing I remember was laying down on the kitchen floor, and that was it. So I was bouncing around the home for 2 days. I don't know what I was doing. And the next thing I know, I'm waking up in the hospital. And it took me forever to even realize it was truly real, and it wasn't a dream, or it wasn't something bizarre. It's not real.
Stroke is no longer just a grandmother's disease. It can happen at any age, any gender. Stroke, 80% of it is preventable, so knowing your risk factors is a must. Anyone who has high blood pressure, high cholesterol, any cardiac or heart disease, just sedentary lifestyle, not exercising, not eating healthy, all pose a risk of stroke, and especially hereditary as well. If you've had a parent or a grandparent who's had a stroke, your chances is higher as well. So you just want to be aware of the risk factors so that you can have them controlled if you do have any of the risk factors. There's 5 classic signs and symptoms that can happen. Sudden weakness on one side of your body, sudden vision changes, sudden speech difficulties, sudden loss of balance. You just feel like you can't walk anymore. And then also the sudden severe headache, described as the worst pain of your life. And you don't have to have all 5 of those symptoms. You can just have one of them. It involves stroke survivors from all ages, but mostly young ages, 40 to 50, and they've come together and meet once a month and share their stories and just talk about how they're doing now, how they overcome their stroke.
I had gotten the literature about the stroke group, and for me the stroke group helped as far as just coming to talk to somebody, like, did this really happen? They're telling me this happened, and I wasn't buying it in my head. So meeting with the people at the stroke group was really important, though, because there's people younger than me that had 2 or 3 strokes, and yet they could walk and they could talk. Some of them had gone through a lot of rehab and a lot harder struggle process than I had, but it was really interesting to see that not everybody is in a wheelchair after a stroke, It's good to have other people to talk to and to lean on and understand things and know where you're coming from, And it is a huge traumatic experience to go through, but yet you come out on the other side and you look back at it and it just seems really surreal. So being able to talk those things through and seeing how other people struggle through things and they get there. It takes them a while to get there, but it's worth the struggle.
They describe themselves as survivors. So I like that term because they're a survivor. They're going on with their life. Having a stroke is not necessarily the end of your life. So it's nice to know that with help of rehabilitation, they're able to regain back any disabilities or learn to live with the disability, hopefully minimum disabilities that they have.
Every 3 or 4 months I feel like a little road mark's been passed, or every 3 or 4 months I feel like, okay, this is much better now. There's still some things, if 4 or 5 things happen at once, that I might miss out on something. My stamina still, after a year, I'm still getting a little bit of my stamina back. I used to be like a 200%er, and now I'm like a 98%er. It's like, but it's getting there. I've met a lot of incredible people since then. Let alone the whole new appreciation for the medical field and the staff and the nurses and the doctors and all that. Thank goodness I came here. When I woke up, they told me I was here, and I really didn't know how I got here, but and this is the #1 place to be. I got the best of care, and Couldn't imagine being able to play any place else.